Dornfeld. I am the founder and physician at Sage Direct Care, and I'm going to tell you how DPC can save patients, save physicians, and save the American healthcare system. I always knew I wanted to be a doctor from a young age. I loved building relationships with people, and I looked forward for caring for them using modern medicine to improve lives. I thought I would be an OBGYN, but I soon realized that family medicine was where I belonged. As a family physician, I could care for entire families. I could do procedures that provide solutions immediately for patients in the office, saving the ER for true emergencies and allowing me to take care of my patients' needs in a timely and cost-saving manner. And that's exactly what I did, and I loved it. But things changed. Continuity of care is the backbone of family medicine, but more and more often my patients were being seen by urgent care and not by me. What happened to seeing my patients when they needed me? Appointment times were shrinking. In 15 minutes, I was tasked with managing a list of concerns, ordering needed tests, ordering medications, and documenting the entire visit. Oh, and offering a compassionate and empathetic ear. If I didn't make time for my patients, who would? My evenings were spent charting, documenting everything I needed to have so I would know about my patients the next time, but also everything that insurance required. Medicare just published a 23-page book on how to document and bill an office visit. Like a frog in a slowly warming pot of water, I realized I was no longer able to care for my patients in the ways they deserved. I was doing more computing and data entry and less doctoring. My family physician friends and I regularly spent 3 or 4 hours charting each night, and studies showed the same. We weren't alone. It turns out most American physicians feel the same way. Thousands of us are struggling with practicing medicine in the year 2022, and sadly, these headlines are not uncommon. Patients are starting to notice too. They desire a relationship with their primary care physician, and they're actively seeking alternative models of care to fulfill their needs. This article was just published in USA Today 2 weeks ago. It was time to take a leap. In 2019, I decided to leave my employed physician, which came with a panel of 1,800 patients, but also a salary, quarterly bonuses, retirement, and benefits, to start my own direct primary care practice. My family and I decided to take the opportunity to live abroad before starting my business. We spent 18 months in rural New Zealand, where I worked as a rural GP and learned to practice in a socialized medicine environment. When we returned, I opened my DPC practice in August 2021. What is DPC? Direct primary care uncouples physicians and patients from traditional insurance and employee health care models. DPC practices enroll patients on a subscription model. Patients pay a monthly fee that covers all of their DPC care, about the same as a cell phone bill, and patients use their insurance for care outside of our office. We are small, we are flexible, and we eliminate overhead. Most DPC physicians care for 300 to 600 patients instead of 2,000. We offer direct communication through portal, phone, and texting. My appointment times are 30 to 60 minutes, which allow us to meet patient needs while in the office and manage more complex conditions, cutting down on referrals. Most importantly, the physician-patient relationship has been restored. It is no secret that the USA spends more on healthcare than any other nation. Our cost overruns have many contributors. DPC saves healthcare dollars. When a Florida hospital system purchased direct care memberships for their employees, patients in the DPC memberships had 39% fewer ER visits. In addition, the hospital employer spent 38% less for their patients enrolled in DPC practices than those enrolled in traditional practice models. We know that patients with complex illnesses do best with regular close follow-up with their physicians, and DPC allows patients to see their physicians as often as needed. DPC is neither new nor rare. The first DPC practice opened 20 years ago, and now there are over 1,500 practices in the United States. DPC restores primary care to its roots, meeting patients where they are and when they need us. By going smaller, not larger, we can improve outcomes, decrease healthcare costs, improve access and continuity, and physicians and patients are finding joy in the physician's office again. There are 2 board-certified family physicians offering care in the DPC model in Columbus, Indiana.